So, hi there, it's James from Momentus, and it's Men's Health Week this week. And I'm interviewing someone that I've known for the best part of about 10 to 15 years. This person I met during my career at O2 Telefonica. We worked together on some projects, but we also spent a lot of time on a more social aspect in when we're both staying away from home, working in the exec lounge, talking a bit of work, talking a bit home. And it's a great pleasure to welcome you and welcome my guest to this discussion, Mr. Darren Buttrick. Darren, how are you?
I'm very well, thank you, James. And yeah, long time no see and speak. Yeah, that opening brings back memories of both work and work at a hotel, both on an evening and catching up on football and just working and socializing. So yeah, good to see you.
Absolutely, yeah. It feels like a long time ago, but I can picture us vividly sitting there. It's almost you
Yes.
walk into the exec lounge and say, right, who from work is going to be here? What's the conversation going to be?
Yeah,
Um,
definitely.
as it is Men's Health Week, Darren, just going to ask you a simple question. What does health mean to you?
Yeah, I mean, I think it's an important aspect of any person's life, not just men's. I think sometimes men keep their health, how they're feeling to themselves, probably more private, individual.
Mm,
I know I probably used to be, but I think the climate that we've just come through and are coming through still has opened up for more people. And I think particularly men are willing to share their stories and how they are feeling and how they're coping and going to
yeah.
cope through these challenging times.
Yeah, I agree with that. I certainly see on social media, I see more men just talking about how they're feeling, or even just sharing posts. I think it's almost a first step of them recognizing what they're going through, recognizing they have a voice just by sharing other people's voices, even if it's just their
Yes.
words or or even a video. I think that's a first step to saying
Yeah.
this is important to me, and even better when they do actually
Yeah.
say something themselves about themselves.
Yeah. And I think it's being able to relate, put yourself in their shoes, relate to that person's experience. Do I feel like that, or do I feel similar to that? And I think then you take strength from people's adversity at times, actually. And I know I've had my own challenges, and I think actually talking about it has
Mm.
definitely helped me get over the emotional aspect of surviving what was a terrible COVID-19 experience.
Yeah, and it's great to have you here, and I'm pleased that you're you want to share that with everyone because it was it was an experience, and I say that from my perspective of someone that was sitting there watching Sky News, and suddenly Darren Buttrick is on the news, and it was attention grabbing and jaw dropping. I think lots of people have been impacted through COVID. Lots of people have lost their lives. People have been told that others have lost their lives. And there was me reading about someone I know who was on the brink. Do you want to? Are you okay just to kind of share a bit around kind of what happened
Yeah,
and obviously then what it's meant for you?
yeah. So going back to March 2020, so I found out afterwards I was the first 2,000 confirmed cases in the UK of COVID-19. I'm sure there was more people that hadn't had a confirmed
Mm,
case. And it just shows how much technology, health, awareness has moved on, because when I was tested, it took just over 3 days to get the results back, whereas now you can
mm,
get results in 30 minutes, if not next day. So it just shows in a period of 12 months how things have moved on.
yeah.
So yeah, I mean, when I first got COVID, I actually felt quite ashamed. I felt quite embarrassed that why me? I thought it was
Mm,
something that'd be done here for a month and then gone. But I actually got it, and it just felt like I was different. So that was one thing to deal with, that I felt quite embarrassed talking about it at first. But then the illness set on, and I had no underlying health issues. Don't take a tablet, don't go to the GP for anything.
mm,
Um, but turned out very ill. And I would say the two symptoms were probably breathing challenges, and I'd probably refer to it as like being strangled.
wow.
Um, and very high temperature. I think it was 40.6 when I went into hospital. So the ambulance came twice, First time was to take me in to test me, and they probably knew I'd got COVID. The hospitals weren't organised then, and that was about March the 10th, so it was very early, 2020. And the second time was March the 20th. The ambulance came about 5 in the morning. And you know you are ill when you can't even open your eyes to the paramedics. You can't even walk down the stairs. They have to get a trolley to take you. They put you on a drip, put you on oxygen. And I knew I was ill, but probably not as ill as I thought. I just thought my body would cope, like anybody typically does, and probably more of a man thinks I'll just get over it, stay in bed or sit on the settee. And when I got to the hospital, and the nursing staff were just amazing, but they said, "You're very poorly," and I'm just pointing to the oxygen to kind of give me more. And the nurses, you know, you're beyond that. You know, if you stay on oxygen, you probably won't survive the night. Your body's kind of starting to shut down. So we've done some blood gas tests, and we need to take you to theatre, put you in a coma, put you on a ventilator, and take you to intensive care. And it was the worst feeling ever, because all of the news at that time was Italy and Spain, and you saw all of those horrid images. And I thought, I don't want that. I can't do that. And they said, that is your only chance. And they said, we're going to give you 15 minutes to send messages and ring your wife and your loved ones and tell them what's happening. And they did say to me, and when I think back now, it still makes me emotional. They said, you know, you've got 15 minutes to ring your loved ones, because it could be your last phone call. You need to prepare yourself and them, because you are very poorly and we don't know what we're dealing with. And that was the terrifying thought of being put to sleep and thinking, I may never wake up again. Have I told people what I wanted to tell them? So ringing your parents, ringing my wife, my children, was the most frightening thing ever. I don't think people could understand. Like any parent, you know, my parents said, "You're not going before us. We will swap places with you." You know, my wife fell to the floor and had to ring the hospital and check what I'd been saying, because I could hardly talk, but she just didn't believe it. But I think a number of people messaged me, and these words always stay true. And I think in men's mental health, or mental health generally, and well-being, you know, fight for your life, don't give up, don't quit. And I think those words always stay with me. My daughter, she was 15 at the time, sent me a text message saying, "Dad," because they didn't know how ill I was. My wife hadn't told them what the end game could be. And she just wrote me a simple message saying, "Dad, please go to sleep, please wake up, and please come home." And it's so simple and so effective. And you think it was so true. And I remember a message from the CEO of O2, Mark Evans. And he put, you know, "Darren, just heard the news. We're all fighting for you. Fight for your life. Don't give up." And many, many people said that, you know, don't quit. And I think that feeling stayed with me. When you're lying on a trolley and being pushed to theatre and you've got a nurse consoling you, it doesn't still stop you fearing the worst and worrying. And I think I got that delirious in the end. I think I was in part giving up. I think I was kind of over the edge and thinking, this is probably it. But there must have been something in me saying, don't quit, keep fighting. And I think those words always stay with me. And I didn't find this out till after I was discharged from hospital. So thankfully, as you can see, I survived 10 days in intensive care. And after a week, they took me off the coma and the ventilator, and I had an adverse reaction to the drugs that they'd put me on. And apparently I'm fighting every nurse and doctor in the room, lying on the bed, pulling every piece of equipment out of my body, keeping me alive. And the doctor decided that actually it was too bad. So they had to put me in a coma and reventilate me and put me back to sleep, which again, I had no idea about. And they had to put all of the tubes and everything back in me. And the nurse said to me afterwards, he said, "You were shouting for your dad all of the time." He said, "You were like a child." He said, "A frightened child." He said, "You shouting, 'Dad, come and save me. Dad, they're trying to get me.'" And he said, "You know, you go back to that child instinct and it's fear." And he said, when I told him afterwards about the messages about fighting and don't quit, he said, maybe that's what stayed with you. And he said it was that don't give up, don't fight.
Yeah.
And he said, you would lay there in a coma and we would look at you. And he said, your eyes just look so frightened. He said, your face, he said, you were 25 years younger than anybody else. He said, so, this illness doesn't care about age,
No. No.
ability, previous illness. You'd got nothing.
Mm.
He said, there was no reason why you should have been in there and so bad, but you were. But he said, you fought and you didn't give up. And he said, we wanted to fight with you. He said, we would sit there. And this is again the comfort and the reassurance and the small touches people can make. He said, we would sit there after loved ones or family or friends had rang the intensive care to inquire about you. And he said, we would sit with you, we would hold your hand, and we would say, your wife's just called, your parents have just called, passed on their love, and tell you to keep fighting, don't give up. And he said, you would be in a coma, but you would gently grip my hand. And he said, it gave us
Interesting.
comfort that actually you were trying to fight. You were telling me, I
Yeah.
aren't giving up. And
Yeah.
he said, that gave us comfort and hope that you were going to make it and you were fighting as hard as you possibly could. So that was my experience. I was in bed 6, and apparently bed 6 in intensive care they went in order. So I was the 6th person with COVID-19 very ill in my hospital, but I was the first person to leave alive. So, I'm
Wow.
very, very lucky in that regard. And since then, I think I would come home, I would go to bed, and I would open my eyes again thinking, I can't go to sleep because I may never wake
Mm.
up. And those
Wow.
feelings stayed for quite a while. And I think I can see an ambulance going past me on the street or in the car with the lights and the sirens on, and it brings emotions back to me. So I think there's still that, I'll call it emotional aspect,
Yeah.
that actually doing the radio interviews, doing this kind of interview, uh, talking to BBC News, Sky News, lots of things in the paper. I did a televised show with some people in the Philippines talking about my experience.
Wow.
I think it actually helps talking about it.
Yeah.
And I think that's been a big healer for me. And when I went on to then donate plasma to help other people, that gave me a lot of comfort that I wanted to give back. People had helped me, people had saved me, whether it was words, medicine, love, care, whatever. People genuinely helped me in my hour of need. So giving plasma to help people fight off COVID was one way of me giving back. I've now started to work as a volunteer at a vaccine centre, just helping.
Amazing.
And again, seeing people's faces thinking, I'm helping you. And they're so over the moon, they're getting the vaccine and getting out of this pandemic.
Yeah.
So for me, it's really helped giving back. I went to the hospital 3 weeks ago and donated a picture that I'd had hand drawn of a bed, an angel, and a rainbow. And they've hung it over bed 6.
Mm.
And they said, we hope it helps everybody in intensive care, but definitely people in bed 6.
Mm.
And when the staff look at it on a dark day, it will give them comfort and hope that what they're doing is helping people,
Yeah.
because they've suffered as much as anybody. So
Yeah.
for me, talking about my experience has definitely helped me recover. There's still some emotional scars, I would probably say,
Yeah.
in my healing, but every day does help.
Yeah.
And I hope I've come out of it a better person. I've had random messages from people all over the world who've seen the story on Facebook or the news and said, my wife, my husband, my daughter, my grandparent is in hospital. Can you tell me what it was like? Can you give me some hope? And all I can do is give hope and comfort and tell them about my experience. And I think it has helped. So I've helped, I won't call it my body, but my DNA has been used to help now with research. So hopefully
Wow.
to understand, why did I get it so bad? How
Yeah.
can it help others in the future? So I'll carry on doing what I can to help others. And I hope this interview gives people that hope, that confidence, actually opening up, talking about it. You can still probably tell can get quite emotional about
Mm.
this.
Mm.
It's close to the heart.
Yeah.
And for me, I know how close I was to the edge. I was very lucky, very fortunate to be saved. it clearly wasn't my time, and I'm so grateful
Yeah,
for that. But I think that don't quit, don't fight. Sorry, keep fighting, don't
yeah,
quit.
yeah,
You know, we love you. And giving people those soft signals, like the nurse gently gripping the hand. And he said it would bring a tear to our eye, just knowing that what we were saying, you probably could listen. You'd never remember that we'd said it.
yeah.
You were giving us a signal that you are fighting for your life. And I would say that
Mm,
to everybody in the darkest time, the darkest hour, whatever circumstance, don't give up. You know,
yeah,
seek help, get the support, talk to somebody, and actually talking to people that you sometimes don't know is often more helpful
yeah,
than people that you do know.
yeah. And Darren, thank you. I mean, it's reading about your story is one thing. Hearing it from you is yeah, it's emotional. And I think there's so many people that will hopefully be sitting, watching, listening now, and thinking, you know, a fantastic kind of for you at the end of the story, and that you've come out of it, and the amazing good that you're doing. And no matter what they're going through, you know, in comparison, they're writing their own story, their own life, and what's going on for them. I think those messages of don't give up, keep fighting, is fantastic. And to talk to people, and it doesn't have to be someone that is close to you. And often, I guess, we would find it hard
Mm,
to talk to someone that's close to us because we'd worry that they might judge us. They might think you'll be fine. You know, just it's a phase. You'll get through it. But actually, you know, for a lot of people, specifically around mental health, it's a massive thing, and it's life changing, life impacting, life taking, and actually just putting a hand up, saying I'm not okay, is
mm,
important. And just find someone that can listen, whether that's someone that but actually they'll just listen and they won't
yeah.
judge and preconceive or anything like that, or it's a professional, or it's someone who is just like a photo I saw yesterday of a guy in a park who set up a couple of chairs, with a sign that just says, if you're not feeling okay, why not take a seat and come and
Mm,
talk. No idea who he is, but just someone who will
yeah.
listen. It's a great idea. Darren, if
It
you
is. Yeah,
no, go on, go
and
on.
I think just to finish, you know, I think we all have our challenge. You know, the nurses that looked after me, they weren't going through it, but they had their own challenges. And the one would say to me, the morning you woke up, I was so emotional because we'd looked after you and that's the outcome we wanted. But I
Mm,
stood behind your bed and stood behind the wall pillar and cried. It was emotional for us. And I think, you know, the impact we can all have on each other is significant. And I think that's what spurred me on to, whether it's donate, and I've carried on donating plasma
yeah, yeah,
to
great.
help others. And, you know, the NHS have asked me to do a radio interview next week to raise awareness. And for me, that's really good because if it encourages one more person to donate blood or whatever it might be, it's a job well done. So for me, and it will help my recovery and emotional aspect from recovering from this. So I owe a depth of gratitude to NHS, to family, to friends, to work colleagues that got me through this and supported me. And I'll never forget that. And that's why I'd like to think now I'm, in my way, giving back and helping others. And the thousands of people I've helped through the doors at the vaccine centre, it's helping them avoid what I had. You know, my antibodies and my plasma and blood products is helping somebody survive something.
Yeah,
Um,
yeah,
but I think talking, sharing experience, and being just a listener, I think is really important, and something I'll take forward. And hopefully, it's made me a better person coming out of it. I didn't want the experience, but I think
no,
maybe it was meant to happen.
yeah, yeah, I agree. I mean, I've got my own story of burnout, which is nothing in comparison. But that experience has made me different. And I guess to wrap up then, Darren, kind of a message which I think will be relevant now to lots of people, just in terms of how it's changed your mindset. If you were to meet and bump into Darren, in the executive lounge in the hotel, where you and I used to sit and talk about work and not work and so on, what would you say to that person from what you've learnt in those in the last year, but even longer? What bit of advice would you give to that person?
I think for me, it's about listening. I think being respectful, you know, tell people how you feel, what you think, what you want, more than you've ever done before, and don't be afraid or ashamed to say how you do feel, and what you do want, because life can be lonely. So I think look up, look out, and don't quit.
Fantastic. Darren, thank you. It's been amazing catching up with you, amazing
Thank you.
hearing your
Likewise.
story from you. Some fantastic words of advice that I really hope people watching this will follow. And also, Darren's talked about donating. So if that's something that you're also interested in and wanting to help other people, then I'm certainly going to look into that, and I'd encourage others to do so as well. Darren, thank you again, and I hope you have a
Thanks, James.
fantastic rest of the day.